Welcome back, everyone. And it's my pleasure to introduce our final keynote panel, but not the final event for the day. But thank you to all who have been continuing with the conference here. And you'll be glad that you did, because there is a lot of very important and, again, inspiring information yet to come. Just before I introduce the next keynote panelists, let me make another quick plug for hopeandhealingconference.com. On that site, you can find the full gallery of the submitted works that we've been enjoying during the breaks, including the posters from the elementary children. So please stop by there. It is a very inspiring site. And again, we were just overwhelmed with the kind of submissions that we received for our call to work. The other plug I do want to make, as we've heard already today, is Give Big CHQ. So it sounds like Chautauqua County is giving big, and just want to encourage that as well. GiveBigCHQ.com. Well, you know, we started the day with the description of our theme, namely the art of hope and healing. And I was thinking, as I was preparing to introduce our next two speakers, how there is a kind of creativity that also comes with starting a new program. We heard one of our panelists in the first session talk about imagination, being able to envision that which doesn't exist yet. And we're about to hear from a couple of folks who, with a lot of others, are envisioning services that are very needed in the county and are having to bring to bear all kinds of creativity, really, as well as expertise to create something that doesn't yet exist. And that something is Strong Starts Chautauqua. We're going to hear about that now. Dr. Tariq Khan is a board-certified pediatrician at Southern Tier Pediatrics. And Leanna Luka-Conley is the Deputy Commissioner of Child, Adult, and Family Services at the Chautauqua County Department of Health and Human Services. So with that, we're looking forward to hearing from both of them.
Thank you, Steve, for the kind introduction. And we are so excited to be here and kind of bringing to attention of some of the folks who may not have heard about Strong Starts Chautauqua. I'm sure a lot of you already have, but our Strong Starts Chautauqua is kind of falls in line with what the topic of discussion is, the hope and healing. The mission, the hope of Strong Starts Chautauqua program, which we'll talk about it in a few minutes, is to provide hope. It is our hope to provide the bright future foundation for children in Chautauqua County, including the families. Our focus is the very young, the 0 to 5 age, because we know how important it is to have the foundation. And the foundation, if the foundation is strong, it leads the way to a bright future. One of the things as pediatricians and folks who are involved in any shape, way, and form with children know that it takes a village to raise a child. And I've used this analogy in the past, but a lot of the work, the groundwork, before even the child arrives, starts prenatally. So one of the goals of Strong Start Chautauqua is to collaborate with our partners and agencies and folks in the county to provide and be the nexus of education to these young women who are either pregnant or planning to be pregnant, so they can make, and these women and families can make informed, smart decisions for their children or children to be. We have had the pleasure, as we have developed our Strong Start Chautauqua program, to work with Dr. Ira Chesnoff, who's a well-known pediatrician out of Chicago. And his model, which he has helped implement across the country and internationally, it's called SART, which stands for SART, it stands for Screening, Assessment, Referral, and Treatment, it's a very validated model that encompasses different avenues of evaluations and screenings and lays the foundation for interventions where they are needed. Chautauqua County is the first county in New York State to have a program of that type, so we are thrilled and excited. I'll not hold the way here and not stand in the way, so I will invite my colleague, Leanna Conley, to help us and kind of define our journey for Strong Starts Chautauqua for the participants and attendees.
Thank you, Dr. Khan. So we are happy to share the Strong Starts Chautauqua journey with you because it's been long awaited. It's been several years. We started on this journey back in 2018. So we'll begin with a brief overview of the initiative's purpose, explain how we're approaching our multi-sector work, and share some observations with you as we near the end of our pilot project and approach full implementation this fall, which is amazing. So what is Strong Starts? So this is a collaborative partnership of more than 50 organizations who care about our county's young children and their families. Maternal child health care providers, child care providers, school districts, mental and behavioral health agencies, child welfare, OBGYNs, pediatricians, you name it, have all first come together in 2018. We came together to form Strong Starts Chautauqua with a mission that every young child in the county should have the best chance to reach full potential. Our vision is that all of our county's children are healthy and their families are informed, engaged, and supported through prenatal education, as well as universal, uniform maternal and child screening and linkage to needed resources and interventions. One of the driving forces in establishing Strong Starts was seeing disturbing trends in the health and safety, school readiness, developmental progress, and overall well-being of the county's youngest children. We were observing escalating instances of child abuse and maltreatment cases, extreme cases of very young children with severe behavioral issues, poor school readiness, and increased cases of family trauma. This family trauma included sharp and steady growth in a substance abuse in cases of prenatal substance exposure, including fetal alcohol spectrum disorder, FASD, and neonatal abstinence syndrome, NAS, which NAS is a withdrawal syndrome that occurs in newborns exposed to certain substances, including opiates during pregnancy. Some of you may be aware that Chautauqua County has the highest opiate burden rate in New York State. According to New York Department of Health data, unfortunately, Chautauqua County is on the map for that. And we have a high incidence of NAS accompanies this. Unborn children in our county are exposed to alcohol, marijuana, tobacco, and opiates, and other harmful drugs of much higher rates than elsewhere. In fact, the rate of prenatal substance exposure in Chautauqua is more than 5 times higher than the state average. Our county's children also experience poverty and associated trauma more than children in other counties. Chautauqua has the 4th highest child poverty rate in the state. Given this unfortunate, challenges facing our young children, our community knew it had to act. Also, we recognize the fact that marijuana was also being legalized, which it has now been. As we explored the work to be done, we realized there was complex interplay of factors involved. An array of prenatal and environmental challenges were facing our young children, such as family characteristics, family trauma, prenatal care, exposure to multiple substances, alcohol and tobacco, early childhood experiences and bonding with parents and caregivers, and other health and psychosocial factors. It became clear that to make progress for our children, we had to address the escalating developmental, behavioral, and mental health concerns related to prenatal substance exposure, not of all which are immediately apparent at birth. Recognizing this, we decided to enlist the expertise of Dr. Ira Chesnoff, who likes to be called Ira, a renowned expert in the fields of child development and prenatal substance exposure, to help determine how best to tackle these daunting challenges.
Thank you, Leanna. I think I'll pick up on this slide. If we can back up, Nicole, to slide 8. I'd just like to go back. So just picking up what Leanna was just mentioning, obviously we can see that, and it's a well-known acronym, and most of us know, and doesn't have to be in healthcare, that if mom is affected, her health, physical or mental health in any shape and way, it affects the child. And in case of where mom is affected by substance abuse, or in some cases legal use of substances in the times of marijuana legalization, the areas that are affected can lead to from mental health conditions, depression, partner trauma, abuse, and then, of course, the altered senses and altered neurology in the brain and nervous system affecting the responses to their unborn and then eventually child who's born. There are obviously medical conditions and diseases that come with drug use and abuse. In children, as a pediatrician, we see that some of the issues start right in the newborn period: poor consolability, poor sleep, feeding issues, failure to thrive, leading to really being susceptible and prone to child abuse, shaken babies, eventually learning disabilities, interaction, self-regulation issues, and then leading into the adolescent and adult years into health issues that prevent these individuals from achieving their true potential and being useful to their families and being useful members of the society. Next slide, please. Now, everything in the human body works in unison. It's a very well-made machine, and if one area is not working well, the other areas get affected. So some of the things that start due to prenatal substance exposure in the form of physical issues and health issues, some of which I just mentioned, such as poor sleep regulation, feeding issues, failure to thrive, other physical conditions, cardiac and pulmonary, can eventually lead to the behavioral issues in these children. And these behavioral issues, if the proper identification and intervention is not done by the folks involved, can lead to lifelong issues. And many of us know folks who have struggled with this as children, people we know in the neighborhood, in our settings, work settings, members of the extended family community, and then this continues into whether it's physical health issues or mental health issues, personal relationship as a lifelong issue. I just did not want to go through the list item reading, just wanted to kind of summarize for the folks. I'm preaching to the choir here. Next slide. Thank you, Nicole. So when I look at the concept of wholesome support, especially because we are talking about young women, families, and children, there are certain key elements of it, and they kind of fit like a glove and stocking into each other. Sometimes some of the things in healthcare, we talk in terms of social determinants of health. So when I look at this slide here, some of these elements are what we screen. What are the social? Well, you know, my grandmother used to say, well, you know, even if the husband and wife, they don't get along, if there's enough money to support the family, a lot of the ills kind of subside. Well, money is not enough. We need other things too, such as quality education, educated and strong parents who can provide that support for their children. We sometimes tend to forget that high quality childcare and early education opportunities are important as well as access to good healthcare, good quality healthcare. And all of those, some of the factors are represented here, some of them are not here, but different sectors of society working in unison to provide a well-balanced, solid foundation for the success of our future citizens. Namely, right now, the young children in Chautauqua County is the prudent way to go. Next slide, please. So the HOPE framework, or healthy outcomes from positive experiences, it's a concept that's well known, and it comes out of the Tufts University studies that they have done on children. And the whole idea is that if we create positive experiences for children, especially the very young, they can counterbalance some of the adverse childhood experiences that quite a few of the children, and the numbers are astounding. If you look at the ACEs numbers, it's based on certain studies, there's a huge number of children at some point in life, at some time, they were exposed to the adverse childhood experiences. So if we create positive childhood experiences, whether they are at home, at school, in the society, hopefully they'll counterbalance some of these adverse childhood experiences, and leading to some of the things that hopefully will not occur, and they'll lead to successful outcomes in these children's lives. Some of the things I'm intentionally trying not to go towards some of the issues that Leanna in her capacity deals with, and she'll mention when her turn on this presentation. Next slide, which is, I believe, slide 12, is I love this seesaw model, and the whole goal and aim and mission of Strong Starts Chautauqua is to be on the green side of this seesaw. We want to counterbalance those risk factors, whether they are due to prenatal or in utero substance exposure to adverse childhood experiences. We want to create an environment, and that's the goal of Strong Starts Chautauqua, working with our community partners in all different venues in the county, that we have that warm and supportive parenting, and the kids have coping skills, and the environment at home and school is stable. So the balance is tilting towards the greener side, or the positive childhood experiences, and we are knocking the ACEs out of the park. Next slide, please. So the SART, or our SART model, or Strong Starts Chautauqua, we are utilizing a universal screening. Our whole goal is to universally screen children 0 to 5 and moms when they are pregnant, so we can identify well, let me take a step back. First goal is to educate these moms, young women, families, and arm them with the tools so they can make better decisions for their families and their children. Side by side, the involvement of the community partners, agencies, schools, healthcare providers, faith-based groups, to create resilience in this group and families. But at the same time, in the doctor's office, healthcare settings, child care centers, daycares, doing universal screening through validated tools, whether these are tools used by the OBGYNs or the pediatricians or family physicians, to see if there are children who are struggling. And universal screening, so it doesn't have to be, that's why we call it universal, does not have to be history of substance exposure in utero. And if we identify these children and families, which we'll see in a few minutes, then we can do a more focused, more targeted assessment, and then wherever the services are needed to put these families and children to success, help them direct in that direction. The top tier of this model is the treatment model. Based on the studies and based on the numbers, hopefully, and most of the times in communities, that peak is very small, And there's very small number of folks and kids that will need that higher level of intervention if we are doing our job at the basement or at the ground level. Next slide, and I think it's Leanna's going to take some time and talk about our collaborative and cross-system collaboration and approach.
Sure. So to accomplish what Dr. Khan has been saying, we need to really approach this in a family-centered approach, a holistic approach, and really go cross-sector systems approach. And that's what Strong Starts is all about. So we want to help children and families thrive. We partner from the health and mental health, family support and engagement, and early care and learning sectors must work in tandem to be able to seamlessly share information about family goals and intervention progress. This is one of the things that we've struggled for a while in our system, is not having that seamless communication, also continuity of care, really having people, step through different gaps during times, or being re-traumatized with the same information over and over again. So we're hoping that a lot of this will be done through Strong Starts. From risk identification through assessment, referral, intervention, treatment, and monitoring of outcomes, the goal is to make sure that all families engaged with Strong Starts are supported at each step of the progress. We don't want anyone falling through the gaps or experiencing any barriers along the way that would prevent them from accomplishing their goals. So to achieve this, Strong Starts includes a navigation and care coordination function, as well as a shared technology approach. These help foster improved communication between system partners that allows them to more efficiently and effectively serve mothers, children, and families, including fathers, for expectant or new mothers in need of treatment or recovery services for substance use disorders. Strong Starts provides a unique set of resources. So this is where mental health associations, peer recovery specialists act as our Strong Starts navigators, offering a non-judgmental, peer-based support for mothers who can rely on them as a trusted ally to get resources needed to achieve a healthier lifestyle and strengthening their parenting skills, or even, looking at the full social determinants of health. The Mental Health Association navigators are trained and coached in the Positive Directions model, which is developed by Dr. Davina Moss-King. She operates Positive Direction and Associates, and they're based out of Buffalo. The Positive Direction model has been used in the Western New York region for a number of years, and positive outcomes and harm reduction for newborns affected by prenatal substance exposure, as well as improved recovery and parenting skills for mothers with substance use disorders have been seen. So we're very fortunate to also have Dr. Davina Moss-King on our team to help drive what we're doing with Strong Starts. So to ensure that all young children who need developmental, behavioral, health, and well-being support proceed successfully through intervention and treatment, we also included a Strong Starts with a resource manager who helps coordinate maternal and child development and behavioral screens and assessments, referrals to needed resources, and navigation to and through transdisciplinary team meetings and intervention treatments for mothers and families. So that was an added thing that we just built into the system, which is very exciting because all the screens and assessments that are being part of Strong Starts, which Dr. Khan will go into detail on the next slide, is great because we want that universal approach and to help our county adopt this universal approach in every organization. Next slide.
Thanks, Leanna. So where are we at as far as the implementation, where we are headed? Strong Starts Chautauqua we are in our universal screening phase. We launched the pilot last fall. with a couple of pediatric practices, OBGYN practices, and we're kind of honing our skills, seeing what needs to be tweaked. And the universal screening involves the screening of moms at OBGYN sites for any substance exposure. The pediatric practices are screening for normal child development through ASQ screens or red flags, picking up any abnormalities there that may need further assessment. But everyone would like to jump 2 steps ahead and go beyond. We keep hearing the questions, when are we going to the next step? When are we going to do more focused assessments? We are getting there. This summer, there are things in the work that we will be partners in the county, and we are in the process of recruiting more partners. We'll go through tier 2, 3, and 4 trainings with Dr. Chesnoff and the team on ground here. So we can move into the next phase, which is more focused parent assessments, more especially children who are identified through universal screening. If there's more detailed assessments needed, that's part of the tier 2, such as sensory profiles, childhood behavior checklist. Once those assessments are done, then there is a transdisciplinary team, which is right now somewhere, but it's taking shape. And that will involve local professionals such as physicians, OTPTs, which is occupational and physical therapy folks, psychologists, social worker, and there'll be some key members of this team, but there'll be folks that will go in and out of this team based on the needs of that family or that child. Out of that team will come out, if there are needs, referral for the parents or specific referral for the child. If we identify a child who needs more detailed neuropsychological, neurodevelopmental eval, those trainings will occur this summer as well to train physicians in the county that we can provide a lot of these services here in Chautauqua County, and the families don't have to necessarily travel out of the area. That is our goal in Strong Starts Chautauqua, to hopefully have centers of excellence here in Chautauqua County to serve the families and young children in Chautauqua County. And it is a collaboration between so many amazing folks and agencies. I've been here 26 years this summer, and I'm just amazed. There's a lot of will. From the referral, the tier 4, and Dr. Chesnoff tells us that by the time we get to the through tier 3 and get into tier 4, it's not going to be a huge number, but these will be the families, these will be the children who are going to need highly skilled, specialized interventions in the form of occupational or physical therapy, psychological intervention, counseling, sometimes medication. That is the goal, to get to that point in our Strong Starts Chautauqua, that we can provide a lot of those services here right in the county. Next slide. I think it's about shared communication, and it says Leanna, so I'm gonna be quiet here.
That's all right, Dr. Khan. So this is the exciting part about the system that we're building, because this really truly is a system. And we know with communication, we have fragmented communication depending where we're at in the system, because we all function in our own organizations and we do things, by the regulations that we stand by. But Strong Starts, we're big on navigation and a care coordination function, but we also knew that we needed to share communication and information tracking. So with this being said, we are partnering with ALCO. So ALCO is a platform that is being developed by Healthy Community Alliance, Strong Starts anchor and fiscal entity, in collaboration with the RT software development firm. So this technology environment for Strong Starts is being funded under a 2-year development grant from the Western New York COVID-19 Response Fund's Moving Forward Together resources. So this is huge because eventually ELCO will be linked with Healthy Link to create a single closed loop referral and information sharing network between all sectors. And Strong Starts is serving as a demonstration project for this innovation. So, I mean, that's exciting. And I know when we first started meeting back, a couple of years ago, technology and having that shared system was big on the agenda to be able to communicate more effectively. So next slide.
So what do you think, Leanna, your takeaways before I kind of give my takeaways?
Okay. So there's been multiple takeaways with building the system. I know one of the initial surprises I had as we all sat around the table, because I didn't always work closely with pediatricians or OBGYNs or the maternity units. I noticed that there was gaps between the communication and what Dr. Khan would receive from the OBGYN, or what the OBGYN would receive from the behavioral health prescriber. So definitely we saw a lot of gaps in the system. And we also saw that we really needed to normalize our approach to not stigmatize parents. We know that, and that's where one of our tools that Dr. Khan went over on our tiered approach is the 4Ps plus, which the OBGYNs jumped right on board with. It's a normalized screening. And, two of the questions is, the one question is, a month before you knew you were pregnant, did you use drugs, alcohol, marijuana? And then there's another question, the month during you were pregnant, did you use? So, really trying to make it part of a conversation, having that dialogue with somebody. I know we still have a ways to go when it comes to medication-assisted treatment, but we are getting there, and we're having those very transparent communications among us partners. So really having that universal approach to prevent, the stigma, to normalize our approach, and really not miss anybody that may be at risk those are huge takeaways for me.
I think my takeaway, and some of my takeaways are very similar to what Leanna, you just mentioned. My biggest takeaway was how to collaborate and create such a consortium of partners and the free flow of information and data sharing. Once, of course, the family gives the consent, I see that as the big barrier, because even now, and I'm so glad we decided to go through this pilot to work some of the kinks before we take the program countywide and have a lot more wider implementation. Some of those things needed to be worked out, and it's not just simple as let's do the screening. The other takeaway was how to have the people buy in. I see it in my own practice. I mean, every week I have to kind of go around and warm people up. Hey, we need to do the screenings. Hey, this didn't happen. So there's an aspect of implementation and people buying in each the silos that we all work in, but then the information has to share or flow between one silo to silo number 2 and number 3. I think if we all become cheerleaders wherever we are in our silos and start firing that information from one silo to the other, that will just lead to where we want to go for that bright future for the families and young children in Chautauqua County. Next slide 18, I believe. So as we continue on that journey to that bright future for the young children and families in Chautauqua County, our hope is that as we provide that as a community, and we say we, it's not Strong Start Chautauqua only, it's the whole community. And I like to use the word community because sometimes I forget there are so many partners. So I don't want to just identify the healthcare partners or the schools or certain agencies. I think we, as a collective term in Chautauqua County, this is where we want to go for our young families and children. And whether it's through education and engagement and outreach, through screening and surveillance in healthcare sectors and at schools, and then referrals for treatment and further intervention to our transdisciplinary team. And from there on, we have to keep certain principles in mind and just kind of be non-judgmental, be there for the families, family focused, and letting the family and the parent feel like that they are the decision makers. We are not forcing onto them the choices they may not be comfortable. And one of the terms that comes to mind for any of the program of this nature and this level is sustainability. Of course, when we use the word sustainability, everyone thinks of, oh, there they come for the dollars and cents. Well, sustainability could be thought of in so many different ways. It's not necessarily always about the funding. It's sustainability the way I and my partners at Strong Starts Chautauqua and the community partners, we think of it as maintaining collaboration, supporting each other to support these families and these children towards the goal, which is the bright futures for these children. So to end our discussion today, and before we go into Q&A, I'd like to invite all the folks in Chautauqua County to join us in this worthy cause and to help us secure a bright future for our children in Chautauqua County. Thank you.
So I was going to have Nicole pull up briefly our Strong Start Chautauqua website, so you can just glance at it. This is beyond exciting as well. It just went live, I believe, yesterday. So many of our partners and policymakers across Chautauqua County will be getting an email with the link. But this is the first that we've been sharing it. If Nicole can pull it up, because I know we were practicing quite a number of times.
I am attempting it. It did disappear again.
Okay.
So I'm working on it.
Does anybody have any questions while we're waiting for that to come up? And I guess I have to read in the...
Just going to continue along the data sharing part is the platform that we are working on. So partners in Strong Start Chautauqua can use. It's just an amazing platform. Once it goes live, the data flow of information will be just so much easier, and folks will get to see what's happening with the family. Once again, the families sign the consent and collaboration would be a lot easier. Oh, there it goes.
There it is. So this is our Strong Starts Chautauqua website, and feel free to get on that tonight and navigate through the many resources. There's a lot of links on there that can help families and also organizations. We also have a partner portal. So our assessments and our forms and our processes are on that partner portal. So most of our partners have the password to get into that, which is nice to have it right on here. Those are the funders that have funded us thus far for our pilot. And of course, Dr. Khan is our spotlight, partner spotlight on our website. But we were hoping to get it up much sooner, and unfortunately, we wanted to make sure that we had just enough, of a foundation that people could actually read and really learn from. And then you'll see lots more stuff being added as we go through this. So Dr. Khan, Cynthia has a question for you. What is age of testing babies for problems with being born with addiction?
Well, There's no specific test, but some of these could be identified as early as within the first few weeks. So there's no specific test, but a lot of these children who were exposed in utero, and we are concerned about withdrawal, right, starting from neonatal abstinence or issues leading on, whether it's fetal alcohol. A lot of these problems manifest in the first few weeks as sleep, emotional regulation, baby's fussy, cranky a lot. And then, of course, as they get older, if these issues linger beyond a few months of age, there could be more specific testing that could be done in a well-trained pediatric office or at Strong Starts Chautauqua, transdisciplinary team. How's that for the plug? By the way, before I forget, I just wanted everyone to know, and this was one of the items, a big hands up for Leanna. She was instrumental in recruiting Dr. Chesnoff to Chautauqua County. So we couldn't have done without her convincing Dr. Chesnoff to come to Chautauqua County. So thanks, Leanna.
Well, we're trying to get him to buy a house in Chautauqua County now, so he'll be a Chautauqua County resident soon. But thanks, Dr. Khan. Any other questions? I know Alex gave us the 5-minute warning. No. And just to add on to Dr. Khan's answer, a lot of the universal screens that are going out there will hopefully be catching things along the way. So whether it's the OBGYN that does the 4Ps plus, which we're hoping every practice eventually will adopt that, to, you know, we have the early recognition screenings, which used to be called red flag screenings. And then we also have the ASQs. So those are some of the universal screenings that we'll be using.
And the screenings are non-specific against one type of addiction versus the other. But these universal screenings, whether it's the red flags or ASQ, they do pick up things that it raises the antennas of the pediatrician and the childcare provider that there's something going on, and you combine that with a good, reliable maternal history on 4P plus and other forms, and that can really help identify these children and who might be at risk and provide appropriate intervention.
And without Dr. Khan's help, it would have been very difficult to get key champions on board from our medical community. So as busy as he is with his own practice, you know, him being part of this initiative has been huge. So all our partners it's just been amazing. Even the retired individuals such as Andy O'Brien and Dr. Ney that are fully involved with making sure that this system gets in place and is sustained is great.